What bacteria besides E. coli cause UTIs? Urinary tract infections are common and often uncomfortable, but did you know that while E. coli is the main culprit, many other bacteria can also cause UTIs? Understanding these bacteria helps in choosing the right treatment and maintaining bladder health. Klebsiella species are gram-negative bacteria that can cause UTIs, especially in older women and hospitalized patients. They are often linked to complicated infections and may be associated with urinary stones. Proteus species, especially Proteus mirabilis, are known for producing urease, an enzyme that can lead to stone formation in the urinary tract. These bacteria are frequently involved in more complex UTIs and can cause recurrent infections. Pseudomonas aeruginosa is another gram-negative bacterium that causes UTIs, but it is less common. It tends to infect people with urinary catheters or those with structural abnormalities in the urinary system. Enterococcus species, such as Enterococcus faecalis, are gram-positive bacteria that often cause UTIs in hospital settings or in cases of complicated infections. They can sometimes resist multiple antibiotics, making treatment more challenging. Staphylococcus saprophyticus is a gram-positive bacterium responsible for about 5% to 15% of UTIs, especially in young women. It is a common cause of uncomplicated bladder infections or cystitis. Besides these, there are less common bacteria like Ureaplasma urolithicum and Mycoplasma hominis. These bacteria are usually harmless but can sometimes lead to urinary infections, especially in certain populations. The type of bacteria causing a UTI can depend on factors like age, sex, recent antibiotic use, and whether there are underlying urinary tract issues. For example, males, people with urinary tract abnormalities, and those recently treated with antibiotics are more likely to have infections caused by bacteria other than E. coli. Hospitalized patients often face a broader range of bacteria, including Enterobacter, Serratia, and even Staphylococcus aureus. Knowing which bacteria are involved is important because different bacteria can have different resistance patterns to antibiotics. For instance, Proteus bacteria can contribute to stone formation, which can make bladder health worse and lead to recurrent infections. Chronic or recurrent UTIs caused by resistant bacteria or complicated by bladder conditions can lead to inflammation, damage, and in rare cases, an increased risk of bladder cancer from ongoing irritation. In summary, besides E. coli, bacteria like Klebsiella, Proteus, Pseudomonas, Enterococcus, and Staphylococcus saprophyticus are common causes of UTIs. Recognizing these organisms helps doctors decide on the most effective treatment and helps prevent complications. If you suspect a UTI or experience symptoms like burning, frequent urination, or pelvic pain, it's always best to see a healthcare professional for proper diagnosis and care. Remember, everyone's situation is different, so personalized medical advice is key to keeping your bladder healthy.